Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good morning. Welcome to Expat Insights. I'm your host, Raju Manthian. Here at Expat Insights, we take external views of internal successes by foreigners, expats, and immigrants who have made Philippines their home and are doing well in Philippines, either in business or society. This Friday morning on Expat Insights, I have a couple, a guest. My guests are a couple from Switzerland, the beautiful country of Switzerland, and they have been in the country for a very long time. They'll tell you how long. And they have been doing good in business and society. It's a wonderful couple, well loved by the community. And they are here to share, talk to me about the subject matter of medicines and social care. Or maybe pharmaceuticals and social well-being, how to look after people. And so my couple today, the Swiss husband and wife, lovely couple, Mr. Reiner Gloor. He is the advisor to PHAP, which is Pharmaceutical's Healthcare Association of the Philippines, and he's been an advisor for the last 5 years. And his lovely wife, Miss Margeretha Gloor, who is the founder of two advocacies. One is known as the Circle of Friend Foundations, and the second one is Wheelmobile, where they provide wheelmobiles or ambulances for people who cannot walk or have to be moved by wheelchair. So good morning and welcome to Expat Insights.
Good morning.
Good morning. Thank you for inviting us.
Thank
It's
you.
a pleasure to speak to your audience.
Oh, it's an honor to have you here because I know how much work you have been doing for this community. Even though I know you have been here for a very long time and I know you a little bit, can you, for the sake of my audience, tell me a bit about your life in the Philippines?
Well, I first visited the Philippines in 1974,
Yes,
and
sir.
I was regional director of finance for Sharing Plough in Hong Kong.
Yeah.
And I was very much welcomed by the Philippines with an earthquake. So that was my introduction to the Philippines.
Okay.
This is
Wow,
the Philippines.
1974. That
Yeah.
is like the bell-bottom days.
Yes. And then after being reassigned to the States, I came back in 1978. I came back to the Philippines as general manager for Sharing Plough. And that was, again, an interesting period because we were still under martial law at that time.
Right, right.
And then I left in 84. After martial law was lifted, I left for the Netherlands.
Mhm.
And following that, a year later, I was attracted to come back to the Philippines by the Zulu group.
Mhm.
And of course, at that time, the Philippines was about to enter into another historical area.
Yeah.
It was before the world famous Philippine Power Revolution.
The people's power, the first
People's
one,
Power,
1986.
exactly. Those were critical and serious days, and yet Filipinos were full of spirit and life.
Yeah. Mhm.
It was amazing to see them flock to Campo Aguinaldo and the Greenhill area and demanding for change, either demanding for change or just being spectators, you see, because it looked like a carnival.
Yeah, I know. I know.
After being in the Philippines for 35 years, I'm still finding something new, something different almost every day.
Yeah.
This makes the Philippines an exciting country to live in.
Yeah.
Its people and its scenery are unique in this world.
Right.
So that, I think, summarizes sort
Your
of
life,
my very condensed form, my life.
Margeretha, because you've been
Margaret.
okay, because it's spelled Margeretha. Between you two here in the last 35 years, if you were to share an incident of wonder and excitement in the Philippines. What would you say was your most exciting day in the Philippines?
Oh my goodness, you know.
Or experience, you know.
You know, we have had so
Not
many.
people, don't say I love people.
I know, I know. Well.
Put
I
you in a
think-
Swiss moment. Huh?
No, yeah. Well, I think really very exciting, and you know, we just spoke about it. Very exciting was the hope in Puerto Azul that everything that they offered us in 1998 would actually happen. It was so beautiful because Puerto Azul is one of the most beautiful areas, I feel, in the Philippines. But the whole thing kind of went, you know, didn't go the way we saw it. It was so beautifully presented that our emotions, we got carried away, and we purchased 2 units in Puerto Azul, and hopefully it will be revitalized now.
Given life back.
But, yeah, because I really believe that's one of the most beautiful
So your
areas.
most happy and exciting moment was when you saw the beauty of Puerto Azul.
Exactly.
That's it. Okay, fantastic. Now, a little bit about your work. No?
Yeah.
You have been with the pharmaceutical industry for 35 plus years, Reiner, no? And can you give us a big picture view of the industry in the Philippines, the pharma industry?
Well, the pharma industry is, of course, has been very much influenced by
Yeah.
the foreign companies over the years, and but alongside, a local industry gradually developed, mainly in the generics area. Unfortunately, there is no real research done in this country, so a lot is done, as it's called, compounding of the products. There's some clinical research being done here, and that is something which is being done now much more often, and Philippines has gained quite a reputation as a good spot for clinical trials by the international community.
By global multinationals
By global
who
companies,
do research,
yes.
so companies like Squibb, Roche, GlaxoSmith, etc.
GlaxoSmithKline, Pfizer,
They're doing a lot of
Novartis,
research,
Merck, Sharp and Dohme.
How huge is the industry in terms of its consumption needs and in terms of its production capabilities?
Well, the market is, by world standards, relatively small still. It's about a $3 billion market. The market is right now split value-wise about 50-50.
Yeah.
On a unit basis, which is really the important thing, is how many patients can be treated by prescriptions and so forth in forms of tablets or injections. The generics, which are basically local and some important generics, is 65% of the market.
Today,
yes. And that is a natural development through competition and so forth. When patents start expiring and so, etc., local companies start entering the generic sector.
So the Cheaper Medicines Act was passed in 2008.
That's
am
correct.
I right?
In
And
2008.
post that, the whole industry has changed its shape and size. Am I right? In terms of usage and...
I think it would have changed, or was in the process of changing anyway. I think it may have given it more impetus, and it accelerated maybe the expansion of local laboratories in the generic sector. But around that time was the period when major so-called blockbuster products started expiring in terms of
their patents.
In terms of their patents. Interesting to see is that those products which were reduced mandatory or a voluntary agreement that they were reduced, there was not a real expansion downwards in those products, even in those compounds, even with the generics. It's a relatively small expansion in units, which shows that the major problem is really poverty. People do not really have access to health care because, number one, they cannot even afford to go and see a doctor or a midwife, or they may not even be there in the province. And usually they have empty pockets. So that's one of the major hurdles to overcome yet. And for this reason, legislation has now been passed with a lot of support from the academe, support from the industry, and many stakeholders like NGOs, consumer groups and so forth, to have something which is called universal health care, primarily for the primary health care sector. And that has been passed now through legislation in the last, before the last Congress closed.
Well, the story is sad, and at least there is hope. No? And the hope is that everyone is coming together.
With the expansion, with the addition of the syntax now, which will allow additional funds to get into the healthcare sector, I think we can hope for quite some expansion.
Let's take a little break. Let's take a commercial break because we have to, for the sponsors who sponsor this show, then we'll come back and go into depth of what's happening in the pharma industry. So you are watching Expert Insights. I'm your host, Raju Mandhi, and we are with Mr. Reiner and Margeretha Gloor, and we are talking about medicines and social care. Stay watching. This is Expert Insights. Good morning. Welcome to Expert Insights. I'm your host, Raju Mandhian, and you are watching Expert Insights. I'm with Reiner and Margeretha Gloor. We are talking about medicines and social care. So let's come back to Reiner, because Reiner was talking about how the cheaper medicines or the Generics Act has influenced the market, making 65% of the pharmaceutical market today to be of the generic kind. Correct me if I'm wrong.
Yes.
In units, in terms of units. But that's not the end of it, because the need for it is to grow much more. The potential for it to grow is much more because there's a lot of needy people out there who cannot afford to see a doctor, cannot afford to buy basic medicines. And Reiner is claiming that not only is the associations, not only are the big players, the big brands, and even the small players, and even NGOs are all, even the government is making special efforts to open up this avenue for cheaper medicine. So Reiner, tell us, how is this happening, step by step, from all these avenues of government and private sector?
Well, I think the term cheaper medicine may be misleading. We really have to look at affordable and accessible medicines, because medicines it's not necessarily if one pill costs you, let's say, 1 peso, the other one costs you 3 peso. Maybe the one for costing 3 peso in the long run is cheaper in taking care of your health problem than the 1 peso one. So there are a lot of issues involved. It's not just the price alone. It depends what care you get in term. It depends on how long the treatment is, and so forth. So
I want to ask you something here, something very basic. No, me and my family sometimes usually depend on biogesic or paracetamol.
Yes.
Yeah, and sometimes we use that synonymously.
Yes.
Saying that, hey, let's have a paracetamol or let's have biogesic. No? The biogesic is slightly more expensive than the generic paracetamol. I don't mind it. You know, for me, it has the same effect. But my family sometimes says we prefer the one that we have to pay a little bit more. Is there, so that means that's what you're claiming, that just because if there's a price difference, there's also value and effect difference?
Because the importance is safety and efficacy.
Yeah.
And usually products are first introduced with a trade name. And a trade name is associated with a company.
Right.
And companies have established their reputation as quality houses.
Okay.
So when the consumer goes into a store, like you mentioned biogesic, he knows this comes from a quality house.
Oh, right.
If he just gets a paracetamol, which just says paracetamol, the consumer is not sure where it comes from.
Wow.
It may be good, but it could be.
You don't know. You don't know.
You're not that sure. That's what it is.
So let me understand this. So you're saying that I will buy a medicine with a trade name or
Yes.
a brand name because not just that I trust the little blue, red or white or blue capsule, but I trust the company, the large team of people who stand behind its performance
Yes.
and its efficacy, if that's a
That's
correct
right.
word. While if I buy the same thing, I'm not sure if it's backed up
Yes,
by
you don't know
solid
the source,
research.
has it been properly stored?
Like it
and all
happened to
that.
Tylenol 15, 20 years ago
Yes,
in the US
exactly.
when there was a little mishap, they pulled out everything and they
That's
took
right.
responsibility. Well, that makes a lot more sense for people who are watching this, so that they don't talk about cheaper medicine, but they talk about affordable,
Affordable,
and what's
and
the other word you use?
Efficacy.
efficacy, safety.
Safety of
Yeah.
this thing. Right. So now, what is my question is the perception that people have that medicines from global company are expensive. Can you explain that? I mean, to me, I don't know. It could be just a perception, but tell me if it's true or false.
Well, again, it relates to person's income.
Yeah.
Though that's why the advocacy is now, and I think it's a general advocacy now, and is also very much endorsed by President Aquino, that we move towards universal health care.
Mm-hmm.
That means that the state insurance, PhilHealth,
Yeah.
basically guarantees that the poor have access to medicine, not just medicine. Medicine is only a part of the total
healing
healthcare,
process, yeah.
healthcare package.
Yeah.
You have preemptive medicine, you have the curative medicine,
Right.
you have hospitalization, services
Right.
and so forth.
Right.
And that has all to be covered so that every Filipino citizen knows that for primary healthcare, cough and cold, and the first tests for cancer
Right.
and so forth are covered by the insurance, and that even special programs are established for certain specific diseases.
So care first,
Care.
prevention,
Yes.
diagnosis, and if necessary, clinical hospitalization.
Right.
Then the little pills and the drinks and the injections,
Yes.
and then post-care too.
Post-care too,
So that's
yes.
what the government and the private sector are
government,
working together for.
Working together, yes.
Fantastic.
So it's in a way PPP, public-private partnership,
Yeah.
today.
Yeah.
And I think we have made great progress on that in the last 3-4 years.
Now, you were with for the longest time with Zulig,
That's
which
correct.
is a distributor and a marketing
Distribution
company.
company,
yeah?
yes.
Would you have an example of any large brand or corporate that is playing an active part in this? I mean, this is not the place to name names, no? But would you be able to cite the best practice?
I mean, you have, of course, hypertension. Hypertension is
Right.
prevalent in these countries. Associated with this, of course, cardiac problems.
Yes, sir.
And very high on the agendas are still cough and cold,
Diabetes, tuberculosis, lung.
diabetes, yeah,
Yeah.
You just mentioned it. Diabetes is
Yeah.
actually almost has reached the stage of endemic proportions.
Proportion, yeah, I know. It's a
Endemic
bit sad, yeah.
proportions, yes. And that has to do with lifestyle, food.
DNA? Genetics?
DNA,
I mean,
some
not
is
genetics.
some may be genetics, not generic, but
Yeah, those are two
genetics.
different things.
Yes.
Yeah.
One can confuse them, yes.
Yeah, I know, it's close,
Yeah.
yeah.
Yeah. Yes, certainly. And the cardiovascular system has...
So which company? I mean, is there a solid private industry that is gung-ho about creating this?
Companies are some companies are specializing in, they're more on the cardio side, they're more on the diabetes side,
Yeah.
they're more on the hypertension and so forth, or cancer. Some
Yeah.
companies specialize in cancer. So that's what the research-based companies are basically. It's a profile of research-based companies. And then the generic companies, they are naturally going after those products which have established themselves well, where the greatest demand is and the greatest needs are, and then it cascades down into the lower echelons of the
So
country.
you're saying generic companies locally or from overseas are already traveling the well-trodden successful path.
Yes.
That means if a certain product has been successful, then they move their whole strength towards recreating that on a cheaper basis. So thus they are at an advantage because they know that this has been successful, and in this...
They know it has been successful on one hand. They
Yeah.
also know that in certain levels, in the lower levels, maybe it cannot be, it's not affordable from the multinationals, let's say,
Yeah.
because the research-based innovative companies,
Yeah.
they still have to do continuous surveillance of their products.
Yeah,
They
yeah.
have to continuously review,
Yeah.
monitor and so forth, and even after 10 years, if they find the
Right.
product affects you negatively or so forth, they will have
Oh,
to
right.
act on it or withdraw it.
I think the word for that is pharmaco-vigilance.
Pharmacovigilance.
Am I right?
You
Eco-vigilance.
got it.
Yeah,
Yes.
it was in your notes. Sorry, sorry. So that means a good, responsible company just doesn't sell it
Yes.
at one go, but it stays with it for years to come.
That's
That
right.
means it stands behind its research and delivery.
Yeah,
Not
that's-
just research and development, but research and delivery. It stands behind it, behind
Exactly.
the performance.
That's why you find some differences in
Oh,
prices.
yeah, yeah.
yes.
That makes sense now. It assures me, because the usual thing is that the big pharma companies are making a lot of money. And so this is the stand, no? This is the explanation for that.
But research and the impositions by regulatory bodies until a product can be brought for market are enormous.
Yeah, I know.
To bring one product to the market costs $1 billion, $1 billion
More or less,
dollars,
millions of
more or
dollars,
less, and it takes years, and the commercialization of a product is maybe 8 years now.
Yeah.
So that's where some
The
of
costs
things,
have to be recovered, what
the
has
cost
been
has to be
invested.
covered. There has to be found a very healthy balance between research, innovative products, and affordability.
Accessibility and
and
affordability.
accessibility, that all citizens can benefit from it.
Right, right.
I don't think the answer is that we have only cheap generics and therefore the poor can only benefit from products which are 50 years old. They should have the right to have access to products of nowadays, of
New
today.
research.
New
Correct.
research.
Reiner, I want you to think about these three questions. Number one is the huge gap of the prices, because I was reading a little article where, let's talk of any life-threatening disease. It costs, say, $3,000 a month to support that, and the generic costs $300. That's how big the difference is. That's one question. The second question is about patents, product and process. No? I would like you to explain to my audience what the difference is, if there's any difference. The product, that means this is my apple,
Yes.
and the way I make the apple. So those two questions. So if you think about that, would you like to tell me? While Margeretha tells me quickly about her wheelmobile in the
All right, let Margaret
yeah, Margeretha, so you
take
wanna
over
tell
for
me
a
bit
while.
about- yeah, pause a bit. Huh? So two questions. Number one is the variance of price is so huge. I know you mentioned it, you explained it. And when will that cut down? And then the product and the process patent. No? Give us a bit of insight on that. And of course, I'll lead you into BFARD or FDA as it is known now. No? That why does it take long? How can that process of approval or registration be expedited? Those are the three questions. So Margeretha, tell me quickly about wheelmobile now.
Okay, well, in 2003, we did not really bring anything new to the Philippines. We brought the idea here that
Yeah.
accessible transportation
Yeah.
is available everywhere.
Yeah.
So we did not bring hope, we brought reality. We
With
built,
wheelmobile.
we
Margaret,
built,
Margaret, can you hold? Can we take a picture of those little backgrounds while Margaret is talking about her advocacies, no? The first one there is,
That is
the truck.
that is the
Can you
wheelmobile.
see it? Yeah, there we go. Yeah.
That's right. That's the wheelmobile. The only thing that is important is the ramp and the safety features inside.
Right, right.
It was built here. That was in 2003. Reiner also helped with at the time.
Yeah.
It holds 2 wheelchairs.
Yeah.
And you're very safe. We say
Yeah.
we hold everything down. Now we have 4.
Yeah.
Now in 2003, we really felt that this was something that would be embraced by persons with disabilities, by the Filipinos. But still in 2013, the awareness is still not there, that a person with disability needs accessible transportation. Now, we just had a meeting at ADB because they do a lot of research on accessibility on transportation. And they've seen the wheelmobile, and if with ADB they can really show that the wheelmobile is a necessity, I think then the awareness will really be created here.
In developed countries, like in the US and certain European countries, I even see those ramps on public transportation.
Well,
not just on ambulances, but everywhere that there is that place where you can go and hop on a bus using mechanism.
yeah, well, in Switzerland, in many countries, it's the law now. Any new bus has to be accessible. But
For
you
people
see,
with disabilities, yeah.
But you see, I don't consider Philippines a third world country. For me,
Yeah.
the Philippines are smart. They're just equal. So they embrace everything,
Right.
from Google to Facebook to whatever.
Yeah,
So,
right.
you know, 10,
Why aren't we
now
embracing
it's
something
15
like
to
that?
20% of the population worldwide have a disability. Because like Reiner would say, preventive medicine is good, it can cure.
Yeah.
But if you have a disability, if you are in a wheelchair, no matter what medicine you take, you will always have that disability. No
Right.
medicine can take that away.
No medicine can
So-
yet grow back a limb.
No.
Not yet,
So
yeah.
I really think we really need to have this emotional intelligence, not hope. Hope is not real. We have to make it real that, that the need of those with disabilities are really addressed.
All right. So let me ask you, so what you're saying is you want higher awareness from society as a general.
Well,
From private and public, that this is a necessity, not just some fancy little social advocacy of someone. It's a massive need.
that's
yeah?
right. Because a wheelchair is not enough. And don't forget, there are so many people sitting at home smart. They could be scientists, mathematicians.
Oh.
They are at home. They have no way to get out. They're
That's sad,
hiding
yeah.
because they have not been able to go to school. They were not able to go to school, so there were no jobs. Many
Right,
people
right.
wanted to go to call centers. There is not enough. There is no transportation.
Oh my
It
God,
is
yeah.
here now. Only since 2003, I think we are the only one here who really offer a vehicle for hire. Now, we were just in South Africa. There is a dial-a-ride which is connected in South Africa, Durban, Cape Town,
Yeah.
Johannesburg. We just got connected just about with them.
Yeah.
We can do the same here. If South Africa, which has a lot of similarities with the Philippines, they can do it, we can do it. They have a big group who really support, big
Yeah.
group of disabled who
Yeah.
are working on it. I need more Filipinos who are in wheelchairs to really make it happen. It's going to happen.
Good, good. And you are supporting this with Coffee Gallery.
Well,
That's the picture next to the Jeep picture.
That is
too.
the coffee gallery, and the painting was done by Freddie Banyas. He's a polio survivor,
Right, right.
not in a wheelchair.
Yeah.
It's the first gallery that caters to persons with disabilities.
Yeah.
It gives not hope, it actually really gives them a real income, because also Cultura is ordering our jeepneys, which are hand-painted. We have 10 artists.
Cultura.
Cultura.
Yeah.
We have our jeepneys there. We need corporate orders so that we can sustain our operation.
Okay.
So I'd like to invite everybody, go to the gallery in Green Hills on the 2nd floor. Our products are there. Our paintings are there.
Yeah.
And I just saw one of the artists the other day.
Margaret, let's take a little break.
Okay.
You need to pause there a bit. I'm going to come back and let
Okay.
you announce your website and phone number.
Okay.
And you can actually make the request that you want to kind of support you need after this break.
Okay.
Yeah. So, ladies and gentlemen, let's take that break. You can see that she's very passionate about what she does, and we'll come back and get more information on how how you people who are watching this, if you want to support her. And she's doing some really good stuff. So stay watching. We are talking to Reiner and Margeretha Gloor on medicines and social care. We'll come back and we'll get that information on FDA, BFAD, and the patent thing on medicines from Reiner after the break. Welcome back to Expert Insights. I'm your host Raju Mandian. I'm with Mr. and Mrs. Gloor, and we're talking about medicines and social care. So Reiner, now tell me about these two things. Number one is the patents quickly, all forms of it, and it takes long. It's a little bit of a bottleneck in BFAD, previously known as BFAD, and FDA for medicine approvals. I understand. That's what I hear. Correct me there and tell me what can be done to improve or spread in that bottleneck.
All right. Let's take FDA.
Yeah.
Following the 9502 Republics Act, 9502, which is so-called Cheaper Medicines Act.
Yeah.
There was
2003.
2008.
Yeah,
2008.
Okay. Yeah.
It was recognized that at the same time we need to strengthen then called BFAD, and it was renamed FDA, and there was a specific law passed for that.
Yeah.
It is being implemented, that law is now being implemented, and that should lead basically that registrations for new products and also for generics should be shortened greatly. So new target set by the new FDA director. He said he will set up a program. It will take a little while yet until it's fully in place. That one could expect normal registration within 6 months. So that would greatly help to expedite new registrations. On the other hand, they have maybe too many registrations.
Sorry, too
many registrations.
Right. The volume.
For instance, for paracetamol, I'm told there may be 700 different products in the market.
God. Okay.
For amlodipine, which is for again a cardiovascular product, that after patent expired has exploded, 40-50 products in the market. So there is a great competition. Okay, competition is great. Competition regulates prices.
Right.
And so in that aspect is great, but on the other hand, it may be also confusing to the patient,
to the consumer.
To the consumer, he doesn't really know what to take,
I would assume
and
so,
there is a risk that maybe we are not having the best quality products in the market, even though they are approved by BFAD or FDA today. But they cannot control every batch which goes into the market.
So if I were a patient and my doctor prescribed me a certain medicine, say for backache or a muscular pain or a stomach cramp or anything afflicting my lungs, no? And if he prescribed me, it would be better for me to sit down with him and ask him for options rather than go to the drugstore and ask for options, because they may give me 50 options while my doctor will recommend me 2 or 3. So it makes more sense to sit down with the doctor.
As a physician, doctors very often prescribe the generic name, which is low, but they underneath prescribe a certain brand. That's the brand the doctor has clinical experience over years. And that's what he recommends to the patient. Of course, the patient can go to the drugstore and through his own research over the internet, which is easy today, or at the drugstore level with pharmacists, he can discuss, I cannot afford the one the doctor prescribed, which is the next best. All right? So that is, the consumer is protected in that sense.
I thought this is where the challenge used to come in. I'm not sure if it is today, that the doctors would prescribe medicines when they were backed up by those brand names, those global brand names. They would only specify that specific brand. Is that true or is that a myth? The fact that if I'm a doctor and I am close to a company, ABC Corporation, then I usually refer ABC Corporation's medicine. Is that a fact or is that a myth?
I think it's more a myth. There may be certain doctors because they prefer certain companies' products because of largely because of their experience.
Right.
Yes, there have been in the past marketing practices have changed over the years.
Yeah.
The industry introduced a lot of ethic codes. Before, doctors were maybe entertained. Certain trips were paid and so forth. This has basically been eliminated.
Right.
During those period of time, it could be that a doctor was a bit influenced, maybe by certain activity, but that should be a thing of the past. I think the industry worldwide has really addressed that issue and issued very strict rules.
I think it also makes sense on part of the consumer or the patient
yes.
to choose their doctor's right. Because
yes.
it's, again, having a little conversation with the doctor and his values and his behavior, and then choose the doctor's right. That also makes sense
yes.
to do that, no?
And the Philippines has also subscribed to what is called the Mexico City Declaration.
What is that?
Which is basically a code which the countries support. It was signed by President Aquino, that companies should behave in a certain way, how they do business and so forth. So ethics practice, and that applies to all companies, even those who are not member of an association who and may not have a code.
So even unconsciously, no cartel be formed.
Yes.
Let it not become a cartel rather than, okay. Reiner, I am happy with whatever answers you've given me. I want to bring it down to a personal level to you, because I really respect what you have done for the industry and what you're still doing for the industry in this country. I have two questions for you. And while you're thinking about those questions, I'm going to give Margeretha a little time. The question is, number one, what are your dreams, your personal dreams for the Filipino community? You being such a leader in this major sensitive industry, what are your dreams for this country that you love? I know you do. That's one. And then, of course, what's your style? That's two questions. Number one, what are your dreams? Number two, what's your style? Marguerite, now tell us, how can the people watching you help you in getting more wheelmobiles on the street? How can they exactly do it?
I think number one is, please visit the gallery in the Green Hill Shopping Center.
It's known as Coffee
Gallery.
Coffee Gallery in Green Hills and
Green Hill Shopping Center, second floor. The space was donated by the Ortigases. We could not afford it.
Where else?
That's all for now.
Coffee Gallery in Green Hills Shopping Center. Go there, buy paintings and
yeah, because it sustains not only our artists, but it also sustains transportation, because our artists also need to be transported by the wheelmobile.
So you use the same mobile for transporting art?
Yeah, even for myself. I mean, I use it with my artists, or I have Lalaine Guanzan, our PR and production manager. She is in charge of all the products we have here.
Right.
She's doing a great job. We need more wheelmobiles. So what we want to do is turn hope into reality.
Yeah.
And we can do that with emotional intelligence. Really use intelligence, use our heart intelligently. There's a wonderful book by Daniel Goleman, and I think it's great.
I know, I'm a student of primal leadership.
I think it is fantastic. So really, hope is not reality, and this is what I wish.
My suggestion, Margaret. I would like people who are watching this show and people who even get to hear about this show, I would like you to invite Margaret to come and talk about her advocacies.
Thank you.
That's a very good opportunity, because if you have a little club, Rotary, or what have you, wherever you are thinking of reaching out to the community, I think it's advisable to call this lady, and she'll share this little endeavor that she has been supporting for the longest time, she and her friends. So call her, she'll tell you how to help, and she'll give avenue for your charity, for your big heart, for your big quotient on emotion, no? So that's what she'll do. So let's bring it back. So your website is www.wheelmobile.
Wheelmobile.org.
Wheelmobile.org, as you see it in the picture, and I'll put it on the YouTube so you can catch it too.
And the telephone there would be...
telephone, okay. You want to announce it?
Well, in the office, 811-2237.
811-2237.
But best the website.
811-2237, that's what you call to get in touch with Margaret.
And may I say, Wheelmobile was made up by our daughter. I didn't know how to call this vehicle.
Your daughter coined the name Wheelmobile?
Yes.
Okay. Well, tell me that. Where is your daughter?
She's in Austria, and our son is in England, and they both grew up happily with lots of fun in the Philippines.
And you love breeding kids in the Philippines. It's nice, isn't it? The culture's nice. Many people love growing breeding children up.
They had a great
raising
time.
Kids, yeah.
They had a great time. Good school, international
Good
school was
and good
fantastic.
culture, very soft
Yes.
tender culture.
Yes.
Reiner, back to you. So 2 questions. What is your dream for this country's well-being and health and care? You being such a big, strong figure in this.
My dream is that we really move to what we call universal health care.
Right, the one that proposed one. Yeah.
That every Filipino in the neck of the woods, wherever he is, has access in the boondocks. Has the services there. He has access to it, and he has access to also innovative, modern new medicines in order to take care also of the newer diseases which Filipinos are also starting to get because they're changing their lifestyle. And that's really my dream, and I still hope that in my lifetime it can be realized.
Amen.
And
amen to that. Yeah.
Yes. So that's it.
And your personal leadership style.
My personal leadership style is generally participative.
Yeah.
When things don't move, I can get a little bit authoritarian. However, some of my staff says it's paternal.
Right.
So I think they realize that once in a while you have to, put your foot down and say, that's what we do now and let's move on.
Must have been challenging coming from Switzerland, a land of perfection where everything works on time, to come into a country where everything... that's what I think, Okay. So cite me examples of your current lifestyle, any scenario that you're doing.
Well, the current lifestyle...
People call you Papa.
Yes, they call me Papa. There are some groups they call me Papa, yes. Papa Reiner. I think it is that chosen probably because I have been participative and maybe paternal in certain ways. I'm still very engaged with Pharmaceutical and Healthcare Association. I have also a small company on the side which I created in between.
What was the name of that company you mentioned?
Burghley Pharma.
Burghley Pharma. That's a distributor or that's
we're basically marketing some specialized products. We have some, and I tried a new model. I wanted to do what is called a virtual company rather than physical company with lots of employees and so forth.
So online purchase of medicine.
It would be online recommendations and online dealings.
So little clinic medicine shop online.
Yeah, we're basically giving certain information to doctors about certain diseases and so forth, and hopefully they will. Very specific.
You call it Burghley?
Burghley.
Burghley. And what does that
Burghley
mean?
means it means a small castle. It's
in Swiss?
In Swiss, yes. It means a small castle, which of course reflects fortification, makes you strong, strength, stability, yes,
consistency.
Consistency. That's what it stands for. Yes.
Okay, let me end this show by asking you, what is besides Puerto Azul? What is your favorite place, holiday place in the Philippines? This is for the Department of Tourism, and this is to invite, of course, more tourists into this country. What's your favorite holiday?
Well, we haven't traveled a lot in the last few years, but at the beginning when we were here in the first few years, we traveled a lot. One of the places we liked the most is really Bohol.
Right.
And Bohol seems to be slightly different than the rest of the country. The people, in a way, and they have embraced the environment.
Right.
They have really practiced plant a tree, protect our environment and so forth, eco-consciousness, and that's what we
Where exactly in Bohol? Any specific?
Basically all over
whole-
Bohol.
all of Bohol,
All of Bohol we traveled. We got the same impressions, the same good feeling. These people really like to take care of their island.
I'm going to Bohol next week. For you, Margaret, what's your favorite place?
Well, I think exciting is Batanes.
Batanes. That's to
Batanes.
the north.
All
isn't
the way
it?
up
that's
on the
all the way
north,
up.
yeah. Because it's great, because at one point you have the China Sea and the Pacific Ocean, and
Yeah.
this is quiet, and here you have this boulder, so it's
It's thrilling
nice.
for you.
It's thrilling.
My favorite place to go to is Sagada,
Okay.
way up in the north.
Yeah.
I love that place. All right, ladies and gentlemen, thank you very much for being on Expat Insights, and may Godspeed on whatever you're doing, whether you're doing it through an industry or through online, or whether you're providing art and, of course, wheel more bills. May God bless you in your journeys, and hope you do good, and hope the people watching this learn from this. This is not, of course, the end of the discussion on the pharmaceutical industry. There's much more retailing, etc., etc. But maybe some other time we'll have Reiner back,
may have
and
another
we'll talk about it.
opportunity. Yes.
Gracias.
Thank you very
Thank
much.
you very much.
Thank
Thank you
you.
very
Thank you.
much. Thank you for watching Expat Insights. I hope you watched it, enjoyed this. We'll see you next week. I'm your host, Ranju Mandian. Stay watching and connect with us either on Facebook, Twitter, or LinkedIn, and of course on YouTube. Every show we do is up there. Good night and mabuhay.